So if you're only missing one tooth, why a dental implant over like a bridge or partial or whatever you normally do?
That's a great question. Well, I'm going to try and explain it as best I can and without technical terms. So imagine that one tooth, my front tooth, is broken. Now, the way that it's traditionally done is I would have to cut down the adjacent teeth. So the teeth on either side I'm going to have to cut down in order to fill one tooth. So that's bad. Why would you do that just to fix one tooth? So I'm going to talk to you in a moment about the ways that we do that. But the bad thing about cutting your teeth down is the average crown lasts about 10 or 12 years. And then you have to have it redone. And then you may need a root canal. And then you need to spread the bridge out now to 5 teeth or 6 teeth. So it's like this snowball effect. So with placing a dental implant in, we leave the healthy teeth alone. Not only that, we're able to allow the patient to floss in between the teeth. Because when you have a bridge, you can't floss like you normally do. You have to get a threader and, you know, I ask my patients, I say, do you do that every day? And the ones that are honest say, no. So imagine, so now we've set this situation up. Maybe they're 35 when they start this conventional bridge, but they get arthritis or something. There's no way they can thread the floss. They're going to get cavities.
So bridge is just patchwork in your opinion? I don't want to put words in your mouth.
I hate to use
but it is temporary.
It's temporary. Where implants I think of as more permanent, because I guarantee patients 2 things about implants, Randy. I promise them they're never going to get a cavity and they're never going to need a root canal. Those are 2 things that happen to our own natural teeth. They don't happen with implants.
So you just give them their tooth back with a dental implant?
Absolutely. Yes. It's as simple as that.
Is that the future of dentistry?
I think so. And with our study clubs, we've really gotten the local dentists to believing this is true, and they've seen it in their own patients now.
Yeah, but what about expense?
Well, the expense is going to, I believe, and I can show patients that over the long term, the implant is going to be far less expensive because we're only addressing the one tooth. We're leaving healthy teeth healthy. Remember, if we get a cavity under this bridge, now we have to do a new bridge. That's 10 years later. The price is definitely going to be more at that time, where if we just address the one tooth, that's it. It's done.
And people missing teeth in the back, like 2 or 3 in the back or 1 in the back. I've been asking around. A lot of people are just missing teeth in the back.
They are.
And so get a dental implant there?
Absolutely.
But I think you said that it could prevent future tooth loss. How?
Right. Okay. Well, so imagine this, because I see that. You had the nail on the head. Exactly, I see that all the time. So maybe a person had one tooth taken out. They thought, and it's in the back. You know, it doesn't, I smile, it doesn't really show, not a big deal. If it were a front tooth, they'll say, Doc, if it were a front tooth, I'd fix it. But it's a back tooth, nobody sees it, I'll get along, I have teeth on the other side. Okay, I tell them why they shouldn't believe that, but that's their belief at that moment. But what we're able to do is we're able to put an implant in that stabilizes the bone, because when a tooth comes out, the bone goes away. And so we're able to preserve the bone. Not only are we able to preserve the bone, but their bite. Because let's pretend that I lost 2 bottom teeth and I have my top ones.
That's common, by the way.
All the time.
Okay.
The top teeth drop down. We have a fancy word, we call it super erupt. That just means the top teeth are going to drop down. They'll eventually, I see people where the teeth are hitting the bottom gum. So the teeth don't stay stable. Also, their bite
teeth
can
start
change.
to shift?
They shift positions all the time.
Because you have a hole, you have a missing area.
Right. The teeth want to fill that vacuum. So by placing 1 or 2 implants, it's incredible. We help people that have partials all the time get rid of that.
So you're the implant guy.
I like to think that.
All
I
right.
love doing implants. It's such a huge help for patients.
And pain is not an issue, you say?
Pain, it is surgery,
Like
Randy.
they don't feel it during the surgery.
They feel nothing
but
during the surgery.
in a perfect world, some of your patients say, that was nothing.
I have patients that say, actually, let me tell you about a patient, an 85-year-old woman I saw just this week. She had a partial. I won't say she was wearing it because she wasn't anymore. She had beautiful teeth on top, all of her teeth on top at 85, had a partial replacing about 6 teeth. And she said, I'm so frustrated, I can't eat, I've spent all this money, I still can't eat. So her doctor referred her to me. He was very reluctant that anything could be done or that she would want to. So she came in, I did my evaluation. I said, Louise, you're a candidate. We can do this. We can put 2 implants over here, give you 3 teeth. We can put 2 over here. You'll be able to chew very well. So the interesting thing, I call her that night.
After the procedure?
After the procedure, that very night, I call her. She said, Dr. Crawford, I have to tell you, I don't know what happened. She said, I'm not having any pain. She said, you did all that work and I don't have any pain. I said, well, I'm happy about that, Louise, aren't you? She said, yes, this is great. But she said, you did so much work. I thought it was going to be so painful. I was so worried about this. It was incredible. I mean, of course, I feel great that.
So that's very common.
It is common. Yeah, it's more common than not.